Jesus, somebody's asking how.
Okay, we good on YouTube. Now hold on, let me go to Facebook. It's not allowing me to do it on Facebook at the same time, Pastor.
I think so.
Well,
So we
it's
just
just
need to,
allowing me to do one or the other.
I'm copying the link and putting it on Facebook.
Okay. Dr. Burton, I'm sending back the host to you. All right, Dr. Burton, the host is back to you.
Sorry.
Wait a minute. Wait, we are live.
We live on Facebook.
No, we have just copied and shared the link to Facebook. All right. All right, brothers and sisters, those of you who are watching our streaming live today, thank you for bearing with our technical difficulties. Pray that you would share this stream with other people as we continue to seek different ways to be innovative, but also inform our people in regards to the very things that help them be even better during this season of COVID-19. We thought it was a very important conversation to have. Recently, I had the privilege of reading an article identified as the Black Plague, written by a young lady by the name of Yamita Taylor. And she identified this very stark and very true fact reality that Black people are, or they endure some of the most disparaging happenings even in America whenever something tragic like this happens. The old saying is still true that when America catches a cold, Black people catch pneumonia. And so we thought it'd be very essential that we have a critical conversation around not only simply COVID-19 and what it means to stay safe and stay at home and follow CDC instructions, but what information is critical for our community in regards to remaining safe and remaining effective during this period. And so we have some great people who have come on today to have this conversation with us. Our very own Dr. Heather Burton, who is not only a faithful and longstanding member at East Mount Zion Baptist Church, but also a renowned author and also a professor and teacher and collaborator and all the above at Case Western Reserve. And she does so many different things that she may share with us. And she has volunteered to be our host today. And she's going to she's going to introduce our guest today, who is on the ground doing great preventative work in regards to not simply just COVID-19, but all kind of things in regards to infections and preventative measures. And so I'm excited for us to have this conversation. If you are on and see this, please share the link and share it with someone else so that we can spread the word to everyone. Thankful for all of our members who have joined us, all of our leaders who have joined us, and everyone who is a part of this conversation, because this conversation is, although the beginning of this conversation, but it is not the end, and we will continue on to have these conversations. But before we begin, let us start with a word of prayer. Let us pray. Lord, we thank you for all of your many blessings. And we thank you, God, that you teach us to be proactive. You teach us to respond to the very things that happen in our lives. And you not only teach us, but you empower us to have this power, have this knowledge, have this wisdom, and do the very things that you've called us to do. Bless this conversation, oh God. And we pray, oh God, that something is said and something is done through this experience that helps those who are watching this and those who will watch this on a later day. Lord, we give you praise and we give you glory. It's in your name that we pray. Amen. I now am going to turn this conversation over to Dr. Heather Burton, and then we will go from there.
Thank you, Pastor Cash. Good evening, everyone, and welcome. Thank you for being a part of our webinar this evening. As Pastor Cash said, we are actually live on YouTube and Facebook, as well as we have some that are actively engaged with the webinar. So it's very interesting on how this came to be, and we came up with this webinar. So Pastor had reached out to me probably right after the stay-at-home order came out, asked me, did I know anyone that could talk to us about COVID-19? And I reached out to a couple of people at in the hospital systems, but at that time, they didn't want anyone to speak on behalf of COVID because it was just rapidly changing. It was changing from day to day, hour to hour. And so I wasn't technically at work, but I was at home working, and I got an email. And then the email was our Case Daily, which is a newspaper that we have. And this article popped up. And the article was about Dr. Knighton. So I emailed Pastor. I said, what do you think about her? I think she would be great to come in and talk to the church members as a body and as a large, the community around preventative measures. And so in that, I reached out to Dr. Knighton, and she agreed. And I think when I think about Dr. Knighton, not only are we colleagues at Case Western Reserve University, but we are also both members of the illustrious sorority, Delta Sigma Theta Sorority Incorporated. So she is one of my sorors, and she is great, very, very gifted and well-versed. And so kind of tonight, what we're going to talk about is, and I know that she has slides that she may want to, you could start sharing at this time, Shanina, as we begin to move forward. Dr. Knighton. I'm going to keep it professional tonight.
Gotcha. So I just have to have it disabled so I can share.
So as she's beginning to start that process, we're in a season with our church of availability. And so making yourself available to the work of the Lord and to others. And so one of the things, our theme, that's why it's called Caring Hearts and Hands, safely caring for yourself and others. And so not only thinking about your role and how you're being safe with yourself, but how are you being safe to assist others? So Dr. Knighton is going to speak a lot with us about that. And so she has some points that she's going to share, which are available on her next slide, which we will deal tonight with COVID-19, kind of understanding social distancing, hand hygiene, safe practical use of personal protective equipment, safe practical steps for caring for self and caring for others. And then she's also going to talk a little bit about life after stay at home. So what do we expect after the stay at home order? And so I would kind of lead into letting Shanina tell her own story. She has an extensive bio and a great bio, but it's not worth me sitting here reading and boring you all from me reading to you. So what I ask of Dr. Knighton is, Dr. Knighton, I guess the most important question is, how did you get involved in doing infectious disease research? How did that come, prevention? How did that come about? And tell a little bit about, your researcher background.
Gotcha. So before we get into that, I just want to kind of set the tone for our talk tonight with our audience, and just remembering, that through all of this, we are God's warrior and not God's worrier. So we have, within the past couple days, past couple weeks and months, have experienced a great amount of change. And I don't think what's been going on has not impacted anyone. But it's just remembering that the information that will be shared this evening, the questions that will be asked, is meant to arm you and provide you with things that'll be able to help you to care for yourself and care for others. So in terms of how I got into this work, so me and Heather are colleagues, or Dr. Burton, are colleagues at Case Western Reserve, and I teach out of biomedical engineering and also nursing. And I came to become a nurse scientist simply because of my experience as a nurse, also as a new mother, pregnant, and working in the hospital. So I've been a nurse for over a decade now, worked the floor during the time of H1N1, Zika virus, Ebola, and know how scary it is, or how scary it can be, but choosing to realize that you have to be courageous during these times and dig deep down inside and realize, okay, well, what do I have to be able to help others? And so during that time, the only thing that I can think about while I was pregnant is I want to keep my patients safe, but I also want to make sure that I'm not transferring anything to me that I could potentially give to my unborn child or take home to my husband and son. And so one of the things that I started to notice was that patients didn't clean their hands. And so from that point on, I started to dig deep into the science to understand why patients in hospitals didn't clean their hands, as well as what barriers they face. And as a result of that, that ended up me becoming very entrepreneurial, also working with biomedical engineering, doing a lot of biomedical engineering work myself, but also really just becoming submerged into understanding that people really don't understand this area. And it's understandable because it takes us as healthcare professionals years and years and years to understand how to manage personal protective equipment in the midst of practicing hand hygiene. And just because we are facing COVID, it doesn't mean that other multi drug resistant organisms and other things prior to today did not exist.
Thank you. And I think, understanding your research and how you got involved is very important to understand the direction that you're going and why COVID-19 and safety and sanitation is so important to you at this particular time. And I was reading your slide and looking at this. I am God's warrior and not God's worrier. And I think as the body of Christ, and very often we also get caught up in this worry instead of thinking about what God has given us. And God has not given us a spirit of fear. And then he also says, be anxious for nothing, but in all things, make your requests known. And so in that, we've got to get out of this fear factor that is also keeping us from moving forward as we deal with COVID-19. And just to talk for a minute, COVID-19 has taken over our life. It is everything that we're dealing with. We see it on TV, we see it on the radio. And to many, it's still not a real clear understanding of what is COVID-19. And even though we're operating in this new world, I say this new world normal, we don't fully understand COVID-19. So I would ask Dr. Knighton for a few seconds, can you take, a few seconds to explain what is COVID-19?
Okay, and so we have some slides to accompany that. So COVID-19 is a form of coronavirus. It's a respiratory illness that can lead to pneumonia. I'm very careful because I know that we're talking about a novel coronavirus or a novel strain, but I just want people to know that it has been around, and I'm speaking of coronaviruses, since the 70s. We encountered severe acute respiratory syndrome, which was a form of coronavirus, the Middle Eastern respiratory virus. The difference is in this particular instance, COVID-19 transmits easily and directly. We don't have any vaccine or any cure for it. We know, just like other viruses, entry through eyes, mouth, and nose. And we know that hands are a high point of transition. But one of the most challenging things right now is we don't know if our bodies are building up antibodies, which the best way to describe that is building up a defense. So saying that we have, it's almost like the chicken pox. So remember, and I might be dating myself, but they would have chicken pox parties. So if one person caught it,
Right.
then they would normally give it to, and say everyone needs to go out in the street and play, and say, hey,
Right.
everybody's going to get calamine lotion, and it'll be done. This, at this point in time, we don't know if that is the same situation with COVID-19. And in some cases, we are even studying whether or not it even causes some sort of organ failure. So just as you mentioned, it is so many unknowns at this point, just in regards to the long-term damage that it'll potentially do, as well as there is a lack of treatment.
Yeah, and I think that that's very beneficial. That as a listening audience, we kind of understand what COVID-19 is. We understand that coronavirus has been around. That's not something that's new, but the strand of COVID-19 is new. It's interesting because when I start thinking about COVID-19 and I start thinking about the process that has happened and what we've gone through within society, it takes me back to early March when everything went haywire for us in the United States as it relates to COVID-19. And I remember I was traveling. I had spent a week in Phoenix and I came back, and then I went to Chicago. And in that process, or in that time frame, I developed a sinus infection my last day in Chicago. And so I was coming home on that Monday or that Sunday. And when I got home, I had to go to CVS and get antibiotics for a sinus infection. And it was amazing how people looked at me in the store because of a cough, a sneeze, a runny nose. And it had gotten to the point with that first week that I had a lingering cough for about 3 weeks. And I kind of would go out and I think I've shared with you, Dr. Knight, before, but with the listening audience, I was in therapy, physical therapy, and I had to cough. And I was so afraid to cough just because of the response that you get from people when you cough. So I was walking around like trying not to cough and taking deep breaths. So Dr. Knighton, with that and understanding that we're approaching the allergy season. And
Yes.
some of us are in the midst of allergy season. Some of us have had colds, flu-like symptoms. How do we distinguish between the symptoms of coronavirus, the flu, allergies, sinuses, cold? What are some of the things that we can pay attention to that would help distinguish between those symptoms?
So, what is important to note? So, we actually prepared this. So, what am I sick with? And so, you're right. We are approaching allergy season. It doesn't mean that people are going to sneeze any less. It doesn't mean that they're not going to have any runny noses. These are things that people have already had. And even now, like there is rumor, like we know that flu season is up right now. If some of the things that were diagnosed, by symptoms that we diagnosed as being the flu, if it was coronavirus, earlier than the cases that we started to see here. And so that information is still, undergoing discovery as well. But if we're looking at coronavirus, and the one thing that we know now is that there's asymptomatic carriers, which means that they are people with no symptoms, and there are symptomatic carriers, which means that there are people with some of these symptoms that are listed here. Now, for asymptomatic carriers, some of the things that they may experience is a loss of smell and a loss of taste. And so, before some of the cases have converted over to be symptomatic, these are some of the things that have been often reported by people is that they lost their taste and they lost their smell. And so if someone is even contemplating, I have the flu, a stuffy nose and not being able to smell food is completely different from having a stuffy nose and not being able to smell anything.
Okay, makes sense. I was actually watching TV earlier, and someone who thought that they had coronavirus. One of the things that they said their early signs they were the loss of smell and loss of taste. And I don't know if I even recognized early on in the process about the loss of smell and the loss of taste. So thank you for sharing that information and kind of clarifying to help us distinguish between the symptoms of coronavirus, of flu, cold, and allergies. And with that, knowing that, okay, it's not my allergy, and I'll use myself as an example, it's not my allergies, but I'm still having these symptoms, and I think I may have coronavirus. What do I do next? What am I supposed to do? How do I handle this, especially when we're still dealing with the accessibility of testing and testing services being available or needing orders from your doctors in order to get tests? What do you suggest? And we know that, and I hate to, I'm taglining, I'm jumping off, but we know that, that's one of the disparities that we're dealing with within, especially the Black community. Specifically is the disparities of testing being available and access to certain things like having a primary care physician that will give you an order to go get tested. So what do you suggest or what's next in this process?
So one thing I do want to say is I do wholeheartedly agree. I would suggest asking yourself if you have been around somebody or been in an area that you may have been exposed first and foremost. And we do understand that getting to a facility or getting to somewhere that's offering testing has been a challenge. I verbalize this and I say this often that for us in our community, and I'm speaking more so of African Americans, one symptom that seems off from our norm, whether it is coronavirus, whether it's related to diabetes, whether it's related to congestive heart failure, warrants being seen. And it is not something that should be ignored because it could be maybe that you are a symptomatic carrier and that is triggering some sort of other reaction other than what has been explained in terms of like widespread symptoms. Our symptoms look different. We understand research wise that our symptoms, our conditions may not be studied, may not be explored, or may not be widely advertised as the norm or something that's in mainstream media. And so I always say that if you are in doubt, if you feel that something is wrong, it is so important for you to call and to ask that you are not turned away. And if it is not your primary provider, there are virtual visits now. There are clinics, there are hotlines that you can call to get access to some services. The blessing about us being here in Northeast Ohio is that we are surrounded by healthcare system after healthcare system. And at this point, whether it is your insurance does not take priority over your life. So I would encourage you to make sure that you can get in somewhere to get swabbed. Now, understanding with these swabs, it is not to tell you out of fear. This is my experience as a nurse of having to swab patients during H1N1. That swab has to go in pretty far in order for us to be able to get a true positive test or to tell if you really are infected. So if you go, there may be fear of the actual swab. But if there is resistance met, then just understand that we may not be able to tell if it is positive if we cannot get an accurate swab. And so this has been a challenge, also, even in consideration of people not having access to testing. But there are alternatives. And so you can ask for a mucus sample, which has to be taken in the morning. And a throat swab can be indicative, but it's not as definitive or it's not as accurate as a nasal swab.
Thank you for that. Thank you very much. And I think, you touched on something, and I don't want to negate the fact that, we're speaking to the Black church and we're speaking to the Black community. East Mount Zion is a Black church. It's a dominated Black church, and I shouldn't use dominated. But when we begin to think about, when we talk about marginalized communities and that norm, that normal of what we expect, or dominant communities, we often, as a Black community, we are part of the marginalized group. So we miss a lot of access, we miss a lot of information, and we miss a lot of services that are available. So I just want to take a moment right now just to thank you for your work that you do and that you're doing, and as it relates to the Black community. And that's not to negate any other community, but that's to say that sometimes we've got to pay specific special attention to who we are as a race, because we know that, things don't affect us the same way. And you said that. And so we have to begin or continue to pay attention to that. I'm going to give a brief kind of switch over, and we have the opportunity for some of our viewers that are directly viewing with us through the webinar to participate in a poll. And so we're going to post this poll right now, and it will show up on your screen, those of you that are participating directly in the webinar. And it's asking you about the stay-at-home order, because one of the things that Dr. Knighton is also doing, as well as myself, is we're tracking and keeping track and understanding as a community how these things are affecting us. So the first question is, during the stay-at-home order, how many times have you been in a public space? For example, a grocery store, religious space, visiting family. And those of you that are watching through Facebook or YouTube, you can also answer this question as well. And so the responses are under 5, 6 to 10, 11 to 15, 16 to 20 times, or over 20. So if our respondents would take a few minutes and actually a few seconds and just mark your answers, and all you have to do is hit the box. And I think about the stay-at-home order, Dr. Knighton, and what has taken, what we have dealt with a lot as it relates to changing our normal behaviors, and our behaviors have changed quite a bit since the stay-at-home order. I know for me, I have the ability to work from home prior to the stay-at-home order, but the stay-at-home order has now combined my whole life. So everything is within the confines of my house. So my work Heather, my church Heather, my community Heather, it's all right here, and I'm working from this space. Mm-hmm. And so it's a great space. And I'm going to give a few more seconds because we have about a 95% rate of response. And I think we'll just go with that, and we'll end the poll. And here are our results. So if you look, 24% said that they have left their house under 5 times. 52% says 6 to 10. And then 10% for our 11 to 15, 16 to 20, and 5% for over 20. And so you can see the results of the poll and what the percentage rate is of those that have left during that time. And so when we think about this stay-at-home order, or we think about going into essential spaces or things that we have to do that's essential, one of the things that we're all focused on is social distance. And we know that within the Black church, and I know at East Mount Zion, you know, and many of the churches still do this fellowship hour. They have fellowship hour where everyone is hugging, greeting. And so as a community, we are used to being able to hug, to be able to touch. I know you and I have always talked about this, you being a huggy person, me being a touchy person, that I have to check myself in classrooms that I'm not putting my hand on somebody's shoulder. But in that, why is social distancing so important? Why do we need to focus on this social distancing? Help our audience to understand.
So for one, I describe a couple of things. So I want to say that in so many words, we've given frontline healthcare staff, and I can say this because I've worked with veterans or taken care of veterans for over a decade now. But in so many words, we've given the frontline staff a crash course in serving. So serving others, meaning that frontline staff didn't know that they were actually going into what I would describe as a war zone when caring for patients and saying, you know, that we meant that we wanted to love patients, but this isn't what we quite signed up for. And so we naturally are trying to figure that out as people go along. It's the same thing with personal protective equipment, with hand hygiene. These are things that while we believe we have always done them right, the science shows us that we haven't. So between incorrect hand hygiene, spit talkers, like we all either are guilty of it or we know someone that does it, kids or adults, you know, maybe sometimes you don't catch that sneeze or that cough that is getting ready to come, but it puts you at risk of these small droplets from being able to travel. And these droplets, they can travel, and some of them have even been known to have aerosols in the air, of where some studies are even showing like, hey, it can live in the air for up to 3 hours. Misuse of personal protective equipment. So that's meaning, hey, if we all congregated and we got together and we had on gloves and masks, it does not necessarily mean that we all are going to be safe. So social distancing adds protection when all of those other mechanisms fail, because all of them have to work together in order for it to be effective. And unfortunately, even in healthcare with personal protective equipment, we're still doing studies around personal protective equipment, hand hygiene, infection prevention and control. Like that's a real area of science, you know, and that's where I've been at for years now. But it's a real thing. And so unfortunately, it is something that even in healthcare we haven't managed to get right.
Okay. Yeah. and and you know, and it's going to take some time with that. I want to take a pause break because we do have a question from one of our attendees, and they would like for you to kind of clarify or answer what are some of the most serious or some of the most serious underlying issues for COVID-19 in Black.
So one thing that I'm absolutely going to speak to, actually, it's a lot. You know that for one, it's our distrust of the system, meaning that it did take a lot of people a long time to wrap their mind around that this was happening, and we call it a suspension of disbelief. The other thing is chronic conditions. And so this is something that I speak with public officials about all the time. I speak with locally, on a state level, and even federally, that the ambiguity in messaging or the messaging that's left for our interpretation has caused trouble. Meaning that when they got on the news and they said, don't go to the hospital unless it's urgent, you can't tell that to a population of people that are plagued by chronic conditions such as diabetes, such as heart failure, such as high blood pressure, such as any sort of chronic respiratory issue. And I can go on, on and on and on. And these conditions are complicated by COVID-19. And so our concern is that, and we've even seen this with children that have serious asthma issues that may need to go into facilities. Their parents, we know that they would typically have flare-ups around this time, but they're not going in because their parents fear taking them to the clinic and that they're going to get COVID interacting with healthcare staff. It's been situations of where people have needed care at home and they fear people coming into their homes. And so I think the underlying issues is the mixed messaging and what we should do with managing chronic conditions and also being able to prevent COVID in the midst of still needing to care for ourselves when we've had these pre-existing conditions.
And early on, and I'm sure you remember this, Dr. Knight, it was a myth that Black people would not be affected by COVID-19 the way mainstream society had been affected. And so now we're seeing that, there's a very often how things are presented, which causes us to think that it's not going to impact us or it's not going to impact our community. And we saw that with early on myths that came out. And those myths very often come about because Black people aren't the people that are being treated. And when they're not the ones being treated, then they're not in the results and they're not in the testing stages, or the research stages. And so we have to pay attention to how we are viewing things and what we're hearing and where we're getting information from. I would say very careful of your sources.
Yes.
And where you're grabbing information from, because if you're grabbing information from people who are not equipped or knowledgeable to give that information, then you have to be careful of what you're receiving. And that's with anything when we think about everything that we learn. And so, our next,
I'm sorry. Yeah, just before even going into that, just two really quick comments. The other piece of it is the CDC and these entities can get on TV and tell us what to do. But just because they list the information doesn't mean that people in our community will have access to it. So the assumptions that people will be able to make masks, assumptions that people will have the cleaning materials that they believe that we should have. Also to a negligence of essential workers. And this is something, that we've had to address on many different regards is the grocery store workers, whether it is, someone, the garbage men, just anyone. And so it's a point in time in history where not just people, that interact with essential workers every day, but people that don't appreciate essential workers are now understanding what it is essential workers do. It's just unfortunate that because these infection prevention guidelines and standards have not been written or established, our people are unfortunately suffering at higher rates because we're likely to have these jobs. And so that is something else to bring up in terms of why it is plaguing the Black community opposed to others, because we are put in a situation, where we may have a relative or a loved one that has to go to the grocery store and work, and they don't have the option to stay home, but they have children that's at home. So how do you balance being able to still be able to provide for your children and also being put in a position of where you have to work and also try to keep yourself safe? And so that's honestly, a lot of what spawned this work is because I do realize that this information is missing. And at some point, somebody has to be responsible for making people give it to them. And I'm speaking of people talking about businesses, put this stuff in place for our people.
Excellent. And it's so true. And when we look around and we look at those that are actually in the workforce right now, and a lot of the essential workers that are essential workers within the stores, the places that we need to shop, we see that they are people that look like us. And it makes me think, when I think about shopping and I think about stores and I think about open public spaces, it takes me to hand hygiene. Okay. And this idea that, we've all been in spaces where we've seen someone that has done something as it relates to their hands that has completely disgusted us. And that's just being straightforward. When you think about even the children in our family, how many times we've had to tell kids in our family or our kids, did you wash your hands? Go back in there and wash your hands. I know you didn't wash your hands. Let me feel them. And so with that, I want you to spend a little bit of time talking about hand hygiene, because I think I read somewhere how there's a small percentage of people that actually wash their hands correctly. And I'm not sure what that percent is or if you have it, but just talk a little bit about hand hygiene.
So 3 to 6% wash their hands correctly.
Oh,
Yes. So that means that me or you might not be doing it right all the time.
I,
So I actually have something on that. And I'm going to talk through it, while we're chatting here. I'm sorry. Give me a second. So it's interesting that you said that because, where is it at? I actually had a video. And so let's see if I can pull it up here. So Ava DuVernay posted this amazing video of this gentleman. It's going to take about 45 seconds to come up. So he puts this dye on his hands, right? And as a result of putting this dye on his hands, you notice that most people wash their hands just front and back like that. So they don't think about other areas that they may potentially miss. And so look at it. It's the finger areas. Like, I mean, I know I don't spend this much time unless I'm in healthcare paying attention to that. Or home. Home hand hygiene may be different than what's in the public. But this is a reality that most people don't clean their hands as thoroughly as they should. And as a result of that, that does unfortunately put us at risk for COVID-19.
were you able to get the video to
So
show?
so guess what? I thought that was it. It didn't show.
It didn't show, no.
Okay, so give me 1 second and I'm
And
gonna
I
put
know
it.
that's a very powerful video that people can actually see
Yes, so
with.
give me 1 second and I'm gonna stop share because I think this was the version I sent you yesterday. So hold on 1 second.
While you're doing that, I
Okay.
actually do have another poll that's available for our listening audience. And so it's kind of talking about hand hygiene and moving us into another aspect of gloves. And so the question is, do you wear protective gloves when in public spaces? And so this is just a yes or no answer. So I ask those that are viewing to answer, do you wear gloves when you're in public spaces? We'll give a few more seconds. And so when we look at our results of those of us that wear gloves and those that don't, it's kind of split. It's 50-50. It's 50% of the people say that they do wear gloves and 50% that say they don't. And
Wow.
so that's interesting to kind of view, is that, there's half and half when it comes to gloves. But I think you have the video up now, so I'll
Yes, and I'm gonna talk through it while it plays just because I mentioned it. So in looking at this, I want us to look at it from two different perspectives, okay? And one of them being from the standpoint of having gloves on and thinking about how many germs could get on there by that being the black ink, but also looking at it from the standpoint of how many areas of our fingers we miss when we're washing our hands or even using hand sanitizer. Missing any of these areas increases our risk for COVID-19, unfortunately. And not just COVID-19, like there are bacteria and viruses and fungus that was around prior to this happening. But it just goes to show what happens when we don't clean our hands as well. And something else, just on the topic of hand hygiene, I would suggest preserve your hand sanitizers for being out in public. So you may have a big Sam's Club bottle that is sitting at home. I would use that as your refill bottle for when you need to go out into the public, but I would suggest washing your hands as much as you can at home. And understanding too, I would also say, like, make sure you're monitoring your hands for any kind of irritation. It does happen from cleaning your hands often. And so make sure that you do use a good moisturizer. And nails. So some of us have long nails. Some of us love our artificial nails because they look very pretty, and this is a part of our identity. However, I must emphasize that COVID loves plastic. COVID can actually live on plastic for 3 to 4 days. This was an NIH study that was done about a month ago, just showing that COVID loves plastic. And so, if you are going to wear them, I do suggest that you get some sort of toothbrush to make sure that you're scrubbing up under your fingernails, because the traditional hand washing methods of 20 to 25 seconds and capturing the actual part of your hand still does not capture what may be potentially up under your nails.
That is a very valid point, because we know that as women, there are many women that get their nails done and get their nails done on the regular. I mean, I know they're probably suffering right now. I was teasing my mom because she's one of those people right now that's suffering from not having her nail appointment. I just got a bottle of acetone so she can take her nails off. But it's one of those things of making sure that we keep our nails and our hands clean. I want to share that with our online viewers that are viewing us live on Facebook and YouTube. They also had even response as it came to wearing gloves. And so about 50% said yes, they do, and 50% said they don't. But a question that came from our online audience is, should we focus on wearing gloves more than wearing masks due to us touching things, especially in the grocery store? And I know that I believe that you're going to share a little bit about mask use as well as when we're shopping and that sort of thing. But with gloves, how does that affect? And I think actually I have a point with that I was thinking, and with this viewer's question with touching things. And it concerns me because I've seen people cross-contaminate very often when they have on gloves.
Yes.
I was in the grocery store and I watched this woman take her groceries out of the cart, go into her wallet, get her credit card, pay with the gloves on. And so everything is cross-contaminating, touching things that are going back to her house, that are inside of her purse, her credit card, and all of that. So is there a real safety in glove use versus no glove use?
So I can tell you that this is after years and years of training and caring for patients. We change our gloves in between patients, and I change my gloves at least 15 times in one room for one patient. If I'm doing, let's say, some sort of dressing change, it happens a lot because you can easily contaminate from touching one surface and then touching something else. I too echo what you're saying, and also know that this has been the case for many people, whether it's grocery stores or being in public settings. You naturally have on these gloves, right? And you've touched all of this stuff. And now you're saying, oh gosh, my phone just rang. Our natural instinct is to automatically reach for that phone. So we've then taken those contaminated gloves and we're now putting it on our cell phone, and we're putting it on a cell phone that then has to come close to our face, with the expectation that there is no possibility that there is some sort of germs on that phone to potentially contaminate us. So for gloves, my suggestion would be, it is very dangerous to use them if you are using them incorrectly, because they can increase your risk for infections. They are meant for one-time use only. And so I've even seen some situations where people are sanitizing their gloves. And I will tell you that gloves are porous, meaning that they're breathable. And so anything that comes onto the gloves has the potential to go to your hand, and anything from your hand has the potential to go to the outside of the gloves. And if you're not cleaning your hands before and after you put the gloves on, then you might as well too not have the gloves on. And so, and I know we were going to address this a couple of slides down, but I think it's just a perfect opportunity to address that, because the viewer is ahead of they're on target in terms of some of the concerns.
Yeah, yeah, and I, that's very one of those things that you don't think about, and you don't think about with glove use, and so it is something that the viewer asked. One question that came through that I want to touch on right now is, and then I know people are sending in questions, and we're going to get to all of your questions, but I just want to kind of touch on some things to make sure Dr. Knighton touches on some things before we run out of time. But one question came in: should you stop wearing contact lenses during this time period?
Some people don't have that as an option. However, if you do have it as the option to wear glasses, I would absolutely say yes. one of the slides that we showed earlier, which talks about COVID being transferred directly to the eyes, to the mouth, and to the nose. Like that is how you get COVID. And so if you do run the risk of potentially having hands and having to put something to your eye, you're running a risk of directly being able to give it to yourself. And it's not to say like, that isn't a risk with absolutely anything else. The thing is with it being highly contagious, sometimes it happens to where a contact may move out of the eye. Your eye may become irritated by it. And your first instinct may be, oh my gosh, I need to really address my eye. And if you don't have hands that are sufficiently clean, meaning that we are showing that 3 to 6% only clean their hands correctly, you're running a risk of potentially contaminating yourself. So if glasses are an option, I would absolutely say use glasses.
So we have another poll that we like to insert right here because it goes back to the callers. I think I'm doing a talk show right now on radio, but it goes back to one of the questions about mask and are gloves more important than mask or is it equal? And that's a mask question that we have right now. And so if both audiences are viewing audience live and then those that are on the webinar, do you wear protective face masks when in public spaces? And so this is a yes or no question again. And so do you wear protective face masks when you're in public spaces? While we're waiting on this poll for a few seconds, I hope the audience is paying attention to Dr. Knighton's slide and how she supports the Black community and the fact that if you look at all her pictures, all of her pictures are reflective of us.
It's not just for here.
When we look at this presentation, we can see us. So often we see things and it's not reflective of who we are. And so I, again, thank you for keeping that in mind. And so our results are in, and we're going to end the poll with 90% says yes, they wear face masks, and 10% say no. That's from our webinar audience. And then I will wait to get the response from our listening audience. And so with that, Dr. Knighton, I know that, there has been conversation about people wearing masks incorrectly and not using masks correctly, even when they put them on. So can you tell us a little bit about what we should be thinking and what we should keep in mind when we're wearing masks?
So a couple of things, just even in talking about masks in general, I want to just take a step back and just share an experience that I had late February from a reporter. And long story short, when he came and asked, he said, okay, I hear that the infection prevention is here. And, we need to know about these masks. These masks are selling off the shelves. Why is it that healthcare workers get N95 masks? And why is it that the public don't? And I just want to clear that up really quick, even before I'm talking about cloth masks or talking about the evidence behind masks. So the difference between N95, let's say a KN95 and a disposable mask, just the overarching difference between those three masks and let's say a cloth mask, is that these masks are disposable. So in healthcare, we know that they are one-time use only, and if they are used more than once, it is shown in the science that they will cause cross-contamination, and they put healthcare workers as well as other patients at risk for getting an infection. These masks were never designed to be a more than one-time use thing. That has changed recently, as you see with the state of Ohio and Battelle, who are now able to sanitize them, but that is still the same case for in the public. Now, when it comes to an N95 mask, we have to undergo what's called an annual fit test. This fit test means that they spray a chemical. So we try on these different size masks and they spray this chemical in the air. And the chemical is supposed to indicate, let's say, a condition such as TB or smallpox, some conditions that we know are absolutely airborne. If I can taste that chemical, which tastes disgusting, that is indication that the infection or like the infectious germs in the air can get through. It is not based off of the size of your face. It is based off of how your nose and your mouth is structured. I know everybody's going to pay attention to my nose and mouth now, but long story short, I could not wear a small. A small was still not sufficient enough for me to wear, and that is as small as they go. So anytime that I would have to go into a patient's room, I had to wear this continuous purified air system that looked like a space helmet in order for me to care for patients. And so I'm saying that to say that for people that were on this craze of, oh, I need to go get an N95 mask, I need to get an N95 mask. They're only one time use only. Um, as far as like spraying them down with peroxide and other things that people are doing, you still don't know if that's 100% going to work. So they are not recommended. So it's not just necessarily a healthcare thing. It is to also make sure that the public understands that they're not 100% effective and one mask is not going to do the job. Now, as it comes to masks in general, there is a lot of controversy. In the state of Ohio, they are not mandated. However, they are recommended. And not only just that, you have some stores and facilities that will not let you inside of their establishments without a mask. And so it's best that you still have a cloth mask in your car in a brown paper bag, and we'll go over that in a little bit. Just to make sure that you have it even if you don't need it. Because I mean, and this is whether you feel comfortable wearing it or not. Like, my job is not to tell others what to do in terms of the mask. And the reason why I cannot say one way or another is because I know that it provides some level of protection, but the data does show, pertaining to cloth masks in the past, that they do not provide full protection. But we're also talking about these masks being tested in scientific settings where influenza and where illnesses are very prominent. So there is controversy over that. The other issue is that if these masks are worn incorrectly, it increases the risk for germ transmission. So if you're just gonna, put it somewhere incorrectly, if you're gonna take it off, put it back on, if you're not gonna launder it properly, you're putting yourself just as at much risk. The other piece of it is, having Black men in my family. I can tell you, not every Black man, is going to be comfortable with wearing these masks. We know that there's been racial profiling as it's come to hoodies, as it's come to other things that we've worn, sometimes just based off of stature, sometimes just based off of how we look. And so there is controversy just about whether or not, should I wear this mask? Is it going to be to protect me from getting COVID? Or if I wear this mask, do I have to worry about protecting my life? These are things that have not been addressed. I can tell you that within my work environment, we have addressed these. And I can tell you that our chief of police has reached out to Cleveland police and surrounding police in the area to come up with some sort of comprehensive plan so this does not happen. But I know that there are larger discussions that need to be had, especially with our suburbs. And two, when talking about masks, one thing that the CDC and World Health does not share, and this was a lot of the motivation behind the Forbes article that I did, was that we're really not addressing the things like the concerns that people are going to have as it comes to masks. Meaning some of us are mouth and nose breathers. And as we know, like, we're talking about something that's going to be on our face constantly. So if it's going to get hot in there, it may cause condensation. We're addressing the summer months now. So now do I have to worry about a heat rash? What do I do if I get a rash on my face? Like, how do I address these things? Even in terms of laundering. So it does mention on the CDC site to launder it, but what should you launder it in? And what I would recommend is not using anything that you would not use on your face as a typical facial cleanser. We know that baby soaps, such as Dreft, if it's safe enough for a baby to use, then you can suspect that it may be sensitive enough for your skin. But even so, I would still pay attention to how your skin interacts after day-to-day wash and use of masks. If it is starting to break out, I suggest that you figure out a way. I mean, and I know that this is unrealistic, but try to minimize the use of masks. They are not necessary at home if you are not sick or you don't have someone at home sick. And then just one more thing. When I mentioned the brown paper bag, I've been seeing people drive around with gloves on and they're touching the steering wheels in their car. They're all masked up. And the mask is not meant for you to wear in your car. And you should take a brown paper bag, label it inside and outside, and put the corresponding side of the mask inside of the bag, because you may have to eat while you're in public or do other things that may require you to take it off from ear to ear.
Is there a particular reason why a brown paper bag is suggested for storage?
So, brown paper bag, because we know COVID holds plastic. And so we're talking about a brown paper bag that would be one-time use. So if you went to, like, let's say a dollar store and you get, what is it, 30 bags, you know that that's 30 days worth of you being able to use that mask once a day. And this is, of course, with laundering it daily, but it decreases the risk, as we know it, for materials that will hold COVID well. Similar
Okay.
to the mail, like right now, like tests are not showing that the mail is holding COVID.
Thank you for sharing that, because that was actually one of my thoughts the other day. I was getting the mail and I was like, I wonder, do I need to spray my mail down right now with my disinfect? Another question that came in really quickly, and then I will move on a little bit, but
Mhm.
is, should we clean and sterilize the inside of our car, the steering wheel, seats, etc.? And I'm thinking that this person is asking this based on maybe after they've been in a public space and they get back in their car. And so what's your thoughts on that, Dr. Knighton?
So I would say a couple of things. Have to be careful about that, because someone may get in the car and just start spraying everything down, and then they have a big electrical issue. So I do think that it's safe to wipe things down in the car, specifically the steering wheel. As far as your clothing and stuff go, and we will talk about this too, your public clothing should never be your in-home clothing. And so the items that you wear in public should not be the items that you're going to lounge about in the home. And I actually saw a question in the chat box about COVID and clothing.
Mhm.
The clothing material is not as much concern as it is the hardware and the plastic wear. So our zippers have plastic. Your item that you're wearing may have some sort of button feature on it that's metal. We know metal, plastic, and cardboard holds COVID. And so you may want to make sure that if you do have to wear those items, that those are the items that are not also too worn around the house, if they have those features.
I would like to share with our audience that we did get the poll from the live audience, and it was about the same for the use of masks. That the majority of the people said that they did wear masks in public. Um, and so as we continue on, you've given us a lot of information as it relates to masks and gloves. And I know, listening to the audience, it could be very overwhelming with a lot of the material. So the material will be available. There'll be the webinar will be posted for future viewing, as well as some fact sheets. And then Dr. Knighton will provide her contact information at the end as well, if you have any additional questions. But as we continue on, we're now ready. We're ready to leave our private space because we got our masks, we got our gloves. How do we approach the spaces of shopping or our essential errands? And when we have to engage in essential errands and make runs, how do you suggest we move forward in that arena, that area?
So caution, it's a lot, but I will tell you, as someone that's a parent, we thought that parenting would be a lot. So it does take a minute to kind of get adjusted too, but it's a lot. And I'm saying it's a lot from the standpoint of we're talking about your clothing should be different. I mentioned, if you just taking that mask, so you may go somewhere that may require it. And it's nothing more daunting than realizing that you needed something from the store, and the store that you needed it from, you can't go into because you forgot these materials. I would also say too, you should have at minimal, like in the trunk of your car, 1 or 2 rolls of paper towels, a bottle of disinfectant, a bottle of disinfectant, or some sort of spray bottle that has rubbing alcohol in it. It can have bleach with 4 teaspoons to 1 quart of water, or some hydrogen peroxide. You can use this for carts or baskets. It can be used for anything that you would have to touch that others may have touched. This is important because it can work effectively. You know, you may need to gently spray your hands down. You may need to spray something down that you're coming in contact with. When we make it to the store, we don't think about the touch screens. We don't think about the pen pads. I can tell you that just alone, and this study will be coming out within the next, I'm going to say about 3 months because publications are slow. But there was a study that we did at the Chicago O'Hare Airport that examined over 700 swabs. And let's just say that 68% of them came back positive for one or more multi-drug resistant organism. And we're talking about the touch screens where people are getting ticketed in or they actually need to do some sort of self-checkout. So even being able to have some sort of paper towel that you can spray and then be able to wipe down the screen or to clean your hands with is essential. Also, too, just not touching your face while you're out in public. I would say if you have a cell phone, if you don't have any sort of urgent phone call or something that is pressing, don't just put it on vibrate. I say silence it. So that way you're not tempted to reach into your pocket with your hands potentially contaminated and grabbing for your phone. And so you want to touch as less things as possible, take less things that are attached to you as possible, so that way you have less things to clean off when you get home. And actually, when you are getting back into your car, and actually, I'm gonna back up a little bit, the cards. And so, Dr. Burton talked about this earlier, you know, with just even being able to have a plastic card and her watching someone handle their card, handle their phone, handle cards, and everything else. Again, COVID loves plastic. So, if COVID loves plastic and your card is plastic, you want to make sure that you are positioning yourself to be able to clean that, but that's much better than handling cash that could have potentially been handled by someone that was sick. And so when you get back to your car, before touching your door handle, you know, spraying your hands, wiping down your door handle, spraying your hands, then removing your mask, not forgetting to place it back in your brown paper bag for you to get into your car. Some of the things that I didn't quite touch on, and this will be on the fact sheet, is what happens if I have glasses and my glasses keep fogging up. You know, every time I get in a car, every time I have on my mask. Well, that's the thing. I don't think you should be using the mask to drive because that is a possibility. And also, too, if your glasses are fogging up with the mask, you may want to tighten it up because it means that either you don't have a good seal or it could mean that it probably needs to be reconstructed a little bit different. When you arrive home, so with your materials, they should be placed on a hard surface. I would designate the same surface all of the time so that way you know when it is clean and when it is dirty. As you take the items out, I would suggest disinfecting them, storing them where they go, and repeating. Do not sit the same items back on that table because remember that that table is now contaminated because the items that you originally sat there were not clean.
Yeah, that is a lot, and but I appreciate this slide, the 13 steps, because I think it's important to pay attention to everything that we're doing and realizing that now we have to develop individual systems of how we operate in our spaces, especially with shopping, and the steps that we take. And once you can establish a process or a system, step one, step two, step three, this is what I'm going to do. One of the things that I do before with my credit card and with the plastic, I keep, and I don't care if I aggravate people in line or not, but I keep my sanitizer and I take my sanitizer and I clean my card before it even goes back into the space. And so we have to begin to pay attention to all of our spaces. We had a question from the live audience is, will we ever have Lysol air spray again? And if so, how effective is it in the home with the daily spraying?
So I can tell you that Lysol is effective, but the same way that you use Lysol, the information that I shared about using the rubbing alcohol, I know maybe not the bleach because you don't want to do anything to, you know, harm materials or some sort of fabric, but even a hydrogen peroxide, if you spray those items in the air in terms of a mist, they are just as effective as having some sort of Lysol spray minus the fragrance. And so I do want to say that those items are just as safe for being able to do so. and they are EPA approved products. So even if you don't get Lysol, the reason why I shared these materials is because I know that these materials are tangible, or we're more likely to be able to get them than looking for Lysol. But in terms of spraying it in the area, I actually, for small businesses that I talk to, I recommend that they do that. So they actually spray down the air before they go inside of working environments where they'll have to be, just to make sure that the area is clear in terms of people's homes.
And Dr. Knighton, actually speaking about people's homes, is I know that as a church, we have a lot of members that are sick and shut in, and we talk about spaces of visiting and how we should have stay at home, or we should be under the stay at home order. We should not be visiting, but there are other needs to come into the home. For instance, with some of our sick and shut in, you're talking about healthcare workers or health aides that need to come in to assist with those individuals that are in their home spaces for multiple reasons. How do you suggest people in their home spaces greet or allow visitors in within their homes? I even think when we talk about these home spaces, talking about receiving packages, how do we receive package? And I laugh because yesterday Amazon was at my house. Today Amazon was at my house. I think Amazon been at my house almost every other day. But
Right.
I know with me, I have my disinfect by the door, and I spray my package down in the same spot before I even bring it into the house. So what's your suggestion on allowing people, especially healthcare workers that may need to assist some of our congregation members or even our community members, as well as receiving different things in the house?
So I know my grandparents used to say parents and family members would be like, don't call before you come. So I think that that absolutely applies in this current climate, and it can help keep you, as well as any visitors that you may have, any home services safe. Meaning helping to, it helps you both to understand the kind of environment that they'll be coming into. Right now, people are scared. Some people may be taking it a lot serious than others. So you would really want to know. So if your aunt does call and say she's coming over, is she bringing three other people with her, or is it just her that's coming? And so you want to ask those things. If you have certain expectations, like, hey, I want shoes off in my house, you want people to prepare to wear clean socks or wear matching socks if that may be something that's bothering them. You may want to let them know, like, hey, anyone that's coming over, I'm requiring them to wear a mask if that's what you would like. If you don't want them to wear gloves, if you do want them to wear gloves, it is your personal space and you have a right to be comfortable, but it's a two-way street, and also making sure that they're comfortable because they're there to do a service for you. And so it's coming up with the plan that you all can agree upon before they come. And then also too, letting them know, like, hey, there are six other people in my home, but I'll give you, an isolated space to be able to work. Or I'm the only one here, but I'll allow you adequate space to work. Or maybe I sanitize the area that you'll be working in. And this was actually something that I spoke about today on a News Channel 5 segment, and just making sure that we understand that workers and people that are coming into our homes are just as scared, but they really want to help us. And so what can we do to keep them safe as well as keep ourselves safe? And so even too, with spraying the Lysol in the air and letting them know like what you've done to keep them safe while they'll be there goes a long way.
Excellent, excellent advice. Um, as we continue to move forward, one of the thoughts is, uh, especially as it relates to the Black community and individuals within our community, is the chronic illnesses, the chronic disease that we face. And I've talked to a couple people that have expressed with their parents, grandparents, this fear. And this fear because early on, and I think you may have mentioned this, there was don't go to the hospital unless it's an emergency. And so people are avoiding hospitals who are actually dealing with chronic illnesses. You have individuals that are not getting their asthma medication or their treatments like they're supposed to do. They're not getting their shots, or not getting checkups that they're supposed to have because they're dealing with heart disease, dealing with kidney failure. And so what's your suggestion or what's your advice to help individuals in our community to feel comfortable, to feel that it's okay. What can I do? But I still need to maintain my regular care because I'm dealing with a chronic illness.
Got you. And I'll touch on that in 1 second. But I also, to your case in point about people being scared to go to the hospital, people are fearful of having people in their homes. And so instituting these steps would help them to do that. So if someone is coming to provide you with some sort of therapy or they need to use some sort of device, ask them to clean the device or ask if they're bringing something to disinfect it, so you know that it's cleaned in between you and the last person that might have potentially used it. And so to answer your question, like as it comes for healthcare, first and foremost, call. And so some people have wellness checkups that are coming up. Somebody may need a prescription, virtual visits, or telehealth. It's here. And so it's been lingering around. The infrastructure has been set up for the last decade. And it was not something that Center for Medicare and Medicaid Services would allow to go through. But now it is alive and well. And I would absolutely say to use it. My mom was concerned about going to her visit. She said, I got 2 appointments on Friday down at the clinic, and I don't want to go down there. I said, it's okay, mommy, call and set up a virtual visit. And she was grateful that she did. And so, but I do say that some people will still have to go out. They may need some sort of test that may require them to go to a clinic, require them to go to main campus of a hospital. And I would just suggest to them that yes, while it is a scary time, be more scared of not managing your conditions and possibly dying from your condition. That is a more scarier thing than COVID right now. It is important to take care of yourselves because fear in itself can lower the immune system. You want to do what you can that is in your wheelhouse. And so taking care of yourself the way that you already have is what we have right now. So there are a lot of unknowns that we don't have when it comes to COVID. But the things that we do know is that we should be managing our conditions, and we know how we've been doing well with that. So I would say that if you have to go out, don't forget a mask. Don't forget, your hand and surface disinfectants, which can be one and the same, as I mentioned with the peroxide, the alcohol. Um, I would say use their accessible hand cleaning products to make sure that you preserve yours. So if they have hand sanitizer on the wall, while you're there, it's okay to use it. You will come in contact with touch screens and pen pads that may require you to sign in. Make sure that you're cleaning your hands after using those. You may sit down in a chair. Remember where you're sitting so you can wipe it down and make sure you keep that space clean while you're waiting. Avoid touching your face and make sure that you clean your hands before you leave. Now, if you're going to one of these settings, like let's say an urgent care or an emergency department, because you do fear that maybe you have COVID or you have some sort of complication, maybe your blood sugar is a little bit too high or your blood pressure is a little bit too high or you are having difficulty breathing, I would suggest packing a just in case bag. The just in case bag should have, clothing in it. Understanding that you may be there for more than one time, having a mask until they get you situated, having something to clean your hands until they get you situated, and understanding that many people go to emergency rooms, they go to urgent care clinics. You want to make sure that you are safe just in case you are admitted and they may not have access to these resources.
Thank you for that. And I know that there are a couple of people probably that are listening in that need that advice and need that assistance and that help. Because the last thing that we want is, like you said, is someone to fall short of life because of a chronic illness and not going and getting the treatment that they need because they've been in this space where they've been told, don't come to the hospital unless it's an emergency. But doctors have been very good, and I would probably add that it's one of the, I've had a couple of visits because of physical therapy, and I kind of felt safe. I felt safer there than in the grocery store and other places that I need to go, just because of watching the fact, walking in and checking my temperature. They're cleaning everything behind me
Yes.
and in front of me. We do have one last polling question, and that polling question is about delivery service. So during the course of the stay-at-home order, have you taken advantage of delivery service? For instance, Amazon, Grubhub, Uber Eats, Instacart. So if you take a few moments just to answer that question, and we will share those results with you. But I know, Dr. Knighton, our time is drawing near, and we'll be wrapping up. And we've covered quite a bit of information. And so as we move forward, I would like for you to give a couple takeaways. And then I would also like for us to deal with um, life after the stay-at-home order. I know you and I have discussed to talk about life after COVID. Right now, we can't even say life after COVID. We have to just say life after the stay-at-home order.
Yes.
And I know that as a church, we have to be very concerned with how we handle ourselves now if we're coming back to worship as a congregation in spaces that are public, in spaces that are close-knit, in spaces that have constant contact. So what's some of your advice for what happens after the stay-at-home order? And then we do have a couple questions after that. So ending our polling right now, it looks like we have 72% that says yes, they've taken advantage of delivery services, and 28%. So what I say to our 78% of people, or 72% of people, is to make sure that you're following Dr. Knighton's guidelines on how to handle the delivery services and the things that you're receiving at your house, because very often we get careless and we don't think, or we don't pay attention to stuff that's being delivered to our house. So pay attention to those steps. But again, I go back to really being cognizant of what's next and how do we handle this life that we have to become accustomed to as we continue to move forward once our stay-at-home order is lifted.
So the one thing that I was hearing a lot of at the beginning was, I can't wait until we go back to how things were. And I am 100% confident. I mean, absolutely 100% confident that we can never return back to how we were. And it's just like the dimensions of a rubber band, a balloon. Once it's stretched, it can never go back to those dimensions. So when we're looking at life after stay-at-home orders, I first and foremost want to say again that there is no vaccine. There is no vaccine. There is limited testing in the state of Ohio. Orders early on, or information early on, shared that as much as 1% of the population can have it. We don't know because not enough testing has been done. And so as these stay-at-home orders are lifted, we have to understand that individuals still very well may be walking around symptomatic and asymptomatic with COVID. COVID, as we know it right now, for the first 3 to 4 months of data, does have chronic effects on the lungs, on the liver, on the heart, on the kidneys, our major organs, in terms of whether it's heart failure, liver failure. This is a reality. And so I warn people to say that stay-at-home orders do not mean that we have a vaccine. It doesn't mean that we understand and we are immune to it. These are still questions that still have to be answered, but we do know that COVID has potential long-term effects if you get it. Now, with that being said, life does have to continue. And as it pertains to church, and opening up, it's one of the most emotional places. We're going to cry, we're going to laugh, we're going to sing. That's what it's about. And that's the way, I don't know of another experience outside of the Black church experience where you're going to get anything different. The passing of the peppermints, though, the passing of the collection tray, the passing of the tissues. In the current climate that we're in, unfortunately, the way in which we show love of someone that we are exchanging tears and moments with has to look different. And I'm not saying that they have to stop. It means that churches are challenged with saying, okay, instead of us passing a collection plate, everyone, we're just going to have this particular area at the altar that maybe we have some sort of ritualistic closing around as people come and drop, their envelopes or their givings into. It may mean that there is some sort of hugs that are not necessarily a frontward hug, but it's some sort of connecting of an elbow or something that, maybe only your church can determine what that would look like. But it's looking at it more so as, hey, in the midst of this time, we were warriors. And we decided that we were going to continue to fellowship, but we were going to do it in a manner to keep us safe. And it's become our change culture because we don't understand if a COVID-20, COVID-21, or another multi drug resistant organism will come in the future. So it does have to change in that manner. I say even too, buffet, right? So whether that is some sort of church occasion or that's somebody going to Golden Corral, it has to change. Like it can't be the same thing where everyone is going down the line touching the same spoon to serve themselves with the expectation that they'll be safe. As we think about menus at restaurants, when we're going out to eat, are those menus going to continue to be there or are they going to be disposable? The condiments that are sitting on the table, will they continue to be there? So these are all things that right now I am working with leadership to determine and fix. So that way employees and patrons, or customers that they serve will be able to be safe. But I encourage you that as you're thinking about this, we all don't have the answers. No one has the answers. But to make sure that you're thinking about it in a manner of not being resistant to change, but saying this is how we're going to overcome and this is how we will all bind together in order to be able to do so. I have shared my information on the right hand side of the screen, one LinkedIn, just to see what I'm up to. Twitter, I'm often posting, if I am doing an article with someone or I find something that's interesting, I keep that pretty much up to date. My work, so I mentioned my space in terms of biomedical engineering, and I'm working with colleagues right now for us to come up with some sort of sensing detecting system, which is a wearable that will allow people to wear things at home. And I'm speaking of whether it's an undershirt or it's a medallion with a sensor in it that will be able to help them to detect COVID symptoms early. We are about 6 months out, though, from a clinical trial, which is shorter than the 12 to 18 months from the time that we're talking about having a vaccine. But our hopes is that we'll at least be able to detect people earlier before they become a complicated case. And I also left the Germ Whiz for Biz there, and that is because for small businesses, grocery stores, and community oriented companies, I have been able to consult and provide them like a specialized plan or just even a conversation for things they need to think about.
Thank you, Dr. Knighton. And thank you for that information. I was sitting here as you were talking about, specifically thinking about the church. I was thinking about everything that I touch in the church when I go, and thinking about the need that as churches, we are going to need severe cleaning and cleaning systems in place that may not have been in place before, where you have industrialized cleaners coming in on a basis, as well as wiping down every time you're in a space within that. And so thinking through all of those things are going to require a lot for churches as they begin to worship back in their public spaces. I know there was a question. I'm sorry, go ahead.
I'm sorry, Dr. Burton. So right before you get into that, one of the things that I will say for anyone in general, and so this is for your church, like I know you actually keep track of the sick and shut in so you all can care for them. And so if they are going to go inside of some sort of hospital facility or they are in one, making sure that they have these tools to be able to equip themselves. And I'm specifically speaking of hand sanitizer and a mask if that's what they feel comfortable with. The other piece is setting up some sort of surveillance system, meaning that when your members get sick, it is important for you to be able to track who is ill, just to understand that if it is a potential COVID case, how do we make sure that we are containing a potential outbreak in our facility? And so this is something that we use year after year, actually not even year after year, but moment after moment in healthcare. And it is why up to this point, we can talk about outbreaks and epidemics and not talk about pandemics because we have these surveillance systems in place. And so you may want to establish these on a more smaller scale for your church.
That's excellent. Great ideas. So thank you for that. Thank you for that additional information. And I
Absolutely.
know there was a question about concerns, and you touched on this, but do you think it's too soon to open up or lift the stay-at-home order, especially when you're looking at places like Florida, like Jacksonville, Florida, where the government is starting to open up and they're talking about opening the beaches? And so, what's your thoughts or your take on that?
So I would tell anybody having to go anywhere, if I were to mentally walk you through, and this is just my experience of systems thinking, you are having to go through and touch those screens that I talked about. You have to go through TSA, which has touched thousands of other people. 9 times out of 10, those people are still going to have those gloves on. Your items have touched that materials, and you then have to get on the airplane where the system is not quite facilitated to filter out all of the air. And I know we've all, or most of us, has been on a plane where someone has coughed. Whether it is allergy
Right.
related or it is cold related. And so just thinking about what that means for a system that does not have that infrastructure in place. It is not to say that life is going to be like this forever, but what I will say is things are not set up right now at this very moment to accommodate a May 1st opening date, which is why the governor did say that he would be tapering how things are opened up. And unfortunately, as we've seen in the media, with our numbers being lower than other places, you cannot hold other places to that same regard that they will keep you as safe as we've attempted to do in the state of Ohio.
Hmm. Especially with travel, yeah. I had a thought. I was thinking about the glove use again, and then I'm going to go to some questions because my mind, when you were talking about gloves and TSA, I was thinking about those that are working that use gloves in the spaces of essential spaces such as the grocery stores, and that they don't change their gloves, and so they're touching everything and giving it to you, and that just hit me like, you still, they're protecting themselves, but you're not protected from them and all the people that they touch or the things that they touched prior to that. So that was just a sidebar thought for our audience. But one of our final questions, and then we have one after that, is
Okay.
should we take vitamins to boost our immune system? It seems that our immune system is the main thing to help fight the virus once you have it.
So, vitamins, just like anything else, have to be built up in your system. And so, you finding out you have COVID today and then starting to take vitamins tomorrow, maybe not so effective. Also, as we talk about vitamins, we also have to talk about other things that suppress our immune system, whether that is chemicals in food, whether we're talking about alcohol, which we know reduces the metabolism within minutes by 70 something percent. And so I'm thinking of it from the standpoint of paying attention to what you're putting in your body. Fruits and vegetables will help you to boost your immune system. Vitamins will help, but food, like natural food, will help you to keep your immune system up. And I would also say, too, whether it is the flu, whether it's coronavirus or anything else, it's almost that thing of where they say stay ready so you don't have to get ready. So putting those items in your body just to know that you'll be able to fight something off later is important.
Thank you for that. And hopefully, everyone should be taking vitamins, but it's one of the, but Dr. Knight, you have already touched on clothing, you've touched on fingernails, but one of the things that we haven't touched on that may be a concern for some people, and I think about myself with my braids and males with beards or facial hair, how does how do they handle that? Whether it's being clean, trapping germs, that sort of thing. What's your suggestions about hair? What do we do when it comes to facial hair or even hair that's growing out of our head or not
Gotcha.
growing that we bought?
So I would say, for one, as hair pertains to your head, I would make sure that if I'm out in public, I'm keeping it out of my face. And this is something we don't realize it. It's in the statistics that people touch their face about 2,000 times per day. It is
Mm,
a part of who we are. And so for women, if hair is sweeping our face, we have something to where we will play with the hair that's in our face or move it out of our face a lot. And so if you pull your hair back, then you lessen the chance of you having to put your hands to your face and it being contaminated. As it comes to facial hair, and I'm speaking of facial hair even before mask, and I did not include this on here because I just put hand hygiene, but on the Forbes article that I did, and I'll make sure that I share that too with you all, is that washing your face. So making sure that you cleanse your face before you even put that mask on. And this is with something, so if your tradition has been, I'm just taking a warm rag and I'm wiping down my face, just make sure that you wipe down your face. As it pertains to facial hair for men, if your beard cannot fully go or be secured in your mask and you have a full seal from the bridge of your nose to up under your chin, then you have to trim it down or you have to get a big enough mask to accommodate that, but to also still be able to get a good seal.
Thank you for that. Um, I don't think we have any more questions from our audience, and I know our time has been spent. But we thank you, Dr. Knight. We thank you for the information that you have given us and that we have received. It has been a pleasure speaking with you this evening, and I'd like to thank you for focusing on the Black community and helping us to realize that even amongst the health disparities, the economic disparities that we deal with, there are people that are trying to address these issues as it relates to us as a community, as it relates to us as a people. And as a community, as a people, we need to also make sure that if you know someone that's not knowledgeable or doesn't have the access, that we are putting that access
Yes.
forward and putting that knowledge forward to assist. So we thank you for taking time out of your schedule, because I know that you are doing numerous interviews, numerous webinars, conferences through the online system now. So thank you.
You're welcome.
And we thank the East Mount Zion family. We thank our Facebook, YouTube viewers that have joined in with us tonight. And as I stated, Dr. Knighton's information, you will see that still on the slide, but you can also visit the East Mount Zion Baptist Church webpage for future that will have the webinar posted, as well as some additional information, some takeaways, some articles that Dr. Knighton will provide for us to keep us safe. And as we continue to move forward throughout this season and throughout this season of COVID-19, I say to you, this is a time for us to be available, as our pastor always says, to help other people, but to also make sure that we're staying safe. So make sure that you're staying safe, make sure that you're staying safe, as well as the people that you're assisting. And at this time, if you aren't in need of going out, then follow the order and stay at home, because the safest place for you right now is at home. Don't be overwhelmed, don't be fearful. As Dr. Knighton said, remember that you are a warrior and not a worrier. So from all of us at East Mount Zion Church, on behalf of Pastor Brian Cash, we thank you for joining us this evening. We thank Dr. Knighton, and have a great and blessed day. Stay safe. Good night.